Cancer of the urinary bladder is one of the most difficult cancers to not only treat but also to cure. So it is very important for us to understand that bladder cancer can be caused by multiple causes such as smoking, such as due to infection, and there are sometimes certain other causes such as industrial pollutants which can cause bladder cancer. Due to this reason, sometimes we find that not all bladder cancers can be cured. Classically, bladder cancer is divided into the non-muscle invasive bladder cancer, the muscle invasive bladder cancer, and metastatic bladder cancer. So, what we mean by this is, so you would understand that bladder, the urinary bladder, is composed of the inner lining called as the transitional epithelium, and beneath that is the muscular part of the bladder cancer, which is responsible for contracting the bladder when you have to go to urinate. And beyond that is basically a lining around the bladder and also the nearby structures. So when the bladder cancer is involving only the inner lining or the transitional epithelium without involving the muscle underneath, it is called as non-muscle invasive bladder cancer. If it is involving the muscle, then it is, even if it is microscopically involving also, it will be called as muscle invasive bladder cancer, in which we subdivide them into muscle invasive bladder cancer which is confined to the bladder, or muscle invasive which have gone beyond the bladder. So that is how we divide the muscle invasive bladder. And third is basically the metastatic bladder cancer, wherein it has gone and spread to other organs. So let us take step by step each of them, and I will only give an outline. If we require further details, please comment in the comment section. I will make further videos on bladder cancer if required. So the non-muscle invasive bladder cancer, basically we have to just remove the tumor that is seen through a ureteroscopy. Basically it is like an endoscopy, but the endoscope goes inside the bladder and it visualizes any of the tumor that is present, and we remove the tumor by a process called TURBT, that is transurethral resection of the bladder tumor. Once we resect this, we give what is called as intravesical or intra-bladder chemotherapy. It can be either chemotherapy or it can be even the BCG. The BCG which used to be used for vaccination against tuberculosis, that can also be used. So this is called as local chemotherapy or local immunotherapy through BCG vaccine. So that is the treatment of the non-muscle invasive bladder cancer. The muscle invasive bladder cancer ideally should be treated with surgery. So the muscle invasive bladder cancer, if it is confined to the bladder, we have two options of treating. One is that we can just take the patient for a surgery, remove the bladder tumor, or another option is we can give some chemotherapy and shrink the tumor as much as possible and then go ahead for the resection of the bladder. These are two valid therapies, but remember, patients do not want to lose the urinary bladder, because once you use the urinary bladder, you have to put certain tubes to drain the urine, which kind of becomes a social issue for many patients. So we have certain organ preservation or bladder sparing protocols which are available, by which we use radiation with chemotherapy to make sure that the tumor is destroyed, the tumor does not spread, and also the bladder is preserved. We can certainly give you more information of bladder preservation, and if you comment on the inbox, I'll certainly make a video on the bladder preservation. But this is how the non-muscle invasive bladder confined tumor is managed. Now, if it goes beyond the urinary bladder, if it is possible to surgically resect, we can surgically resect the bladder along with the extension beyond the bladder, follow it with chemo, or we can even give chemotherapy before the surgery so that the tumor can be shrunk as much as possible, followed by a surgery. What happens when the patient comes with metastatic bladder cancer? In this case, we have two major options available today. One is chemotherapy, which is something which is a standard from the last 10 to 15 years. But now we have newer treatment modalities such as immunotherapy, and immunotherapy has truly revolutionized treatment of bladder cancer, where we can achieve large control of the bladder cancer for a long duration. So folks, these are the ways by which we can treat bladder cancer. If it is non-muscle invasive, we need not have to remove the bladder. We can just give resect the tumor and give chemotherapy or immunotherapy. For the muscle invasive, we make sure that either we do a surgery around chemotherapy or give chemoradiotherapy so that the bladder can be preserved. And if it is a metastatic bladder cancer, then we can give chemotherapy, immunotherapy in certain cases, or just immunotherapy, by which we can achieve long-term control of the bladder cancer.